One of the main barriers to people seeking out IBS treatment options is that they're just constantly downplayed by the medical profession. And this might seem like a hot take, but the amount of people I know that have IBS, clients that have IBS, friends that have IBS, and we all have one thing in common, is that our initial doctor that we went to essentially said, you're probably just stressed about something, go home, it's just a minor inconvenience, you'll be okay. And that really troubles me because it's something that I recognized in my story. So for me, I got diagnosed with IBS when I was 14 or 15, and the doctor essentially said to me, you're just stressed about exams that are coming up, because I had my GCSEs. It's probably just a bit of anxiety, go away and see if it gets better. It didn't get better. A year later, I went back and I said, hey, I'm still having these symptoms. They're every single day. It's really I'm really struggling socially with it. I can't really go to any parties or anything because I'm just so worried about this. And the GP essentially said to me, you're probably just worried about the results of the exams that you've just done, which I was like, wow, that is incredible. So I went away and I essentially then had this stigma in my head that IBS wasn't that, it was just something that I was blowing up. It wasn't something that was actually a real issue. And I was just kind of making it up in my head. And this is a common story that a lot of people have. And so when I speak to IBS patients, a lot of the times they've had IBS for about 5 or 6 years, and then they've put their foot down and been like, you know what, I can't tolerate it. But what really hurts me is the fact that they've had to wait 5 to 6 years to build that up. And because they've seen one of my TikToks or one of my Instagrams, it's then inspired them to book an appointment or see their doctor or really try and get help for it. And that shouldn't be the way. I can't think of any other condition which is downplayed that much. I'm sure there are some, but yeah, just wanted to share my story and how crazy IBS is still viewed in the medical profession.